Dr. Nicholas Mercer with You Improve PT. Recovering from hip pain can sometimes seem hopeless. Many people stop going for walks or being active when their hip starts hurting in hopes that the pain will go away with time. Unfortunately, even if this does help, the pain tends to come back as you start to become active again. It's an incredibly frustrating and discouraging cycle that seems to have no end. And that's because the body has not changed how it moves. Moving properly is crucial to keeping your hips healthy and pain-free. But moving properly requires strength in the muscles that control the hips. And in most people, a muscle called the gluteus medius is weak or underactive. This muscle right here supports the hip joint during nearly every movement of the hip. And it controls hip abduction, although different parts of the muscle also control external and internal rotation of the hip. There are tons of exercises that help to strengthen this muscle, but you don't need to start out by doing 15 different exercises, fatiguing the muscle, then being sore for a few days before you can do the same thing all over again. I'm going to show you one simple exercise sequence that will get you started with controlling and strengthening every movement of the gluteus medius, so you can break the pain, rest, pain cycle and get back to an active life. So this exercise is called a clamshell, and if you've ever done physical therapy for your hips or your lower back, you've probably done a clamshell exercise before. However, there's a specific way I'd like you to do them to make sure that we're activating the right muscles, we're not compensating, and we can really control every single action of the glute med. So first thing I'm going to have you do, you're going to lie on your side, basic clamshell position, right? So we're going to be here, and this would be your regular old clamshell, right? But here's what a lot of people do wrong. If you look at my hip here, a lot of people shift their hip back in order to get that knee up, right? Shift their hip, try to get their knee up, right? What I want you to do is, just like I was, place your hand here and feel the muscles under there. I want to make sure they tighten. So I want you to almost feel like you're doing a side crunch, kind of like that, without your body moving. So you should feel those muscles tighten. And those muscles are going to stay tight throughout this whole movement, okay? And we're going to start with the basic clamshell. So this is going to help with the external rotation and abduction portion of the gluteus medius. So all you're going to do, again, keep those feet together, keep this oblique muscle a little bit tight. Just bring that knee up as high as you can. 1, 2, 3. Slowly come back down. Okay, we want to control it throughout the entire movement. Okay, and you should feel that glute med right through the side here, tightening and starting to fatigue and burn a little bit the more you do it, right? And you can see how slowly I'm doing this movement, right? So this is kind of one range, but I would like you to try a few in different ranges of hip flexion, as long as you're not getting hip pain, okay? Because that's going to change the angle on the specific muscle fibers of the glute med that are working, okay? You can even drop it down a little further there, come up like that, as long as we're not compensating by rolling the hip back, okay? So that's kind of the simplest form of clamshell that we can do. But I want to show you how we can start controlling the internal rotation part of the gluteus medius. It's going to be the anterior fibers. And so, again, I want you to lock in right here. And now, instead of keeping the feet together and letting the knees, the knee come up, you're going to keep the knees together and let the foot come up. Okay? And back down. Up and back down. Okay? And you're only going to go as high as you can without having hip pain, but you should feel that same muscle burning, maybe a little bit more towards the front of your hip, but overall it's going to be the same muscle, okay? This is working internal rotation. And again, real slow. We want to control the concentric portion, have an isometric hold, and then slowly control the eccentric portion. Again, different angles, right? So I know that if I'm up here and I try to do it, my hip doesn't like that quite as much, I'll do a few more reps this way. And then over time, I'm a little better. I get less pinching. I get less discomfort at higher angles of flexion. So now, here's a really fun part. So now you're going to do just abduction. So you are just going to take the entire leg just as it is and lift it up. Okay, so this is the third component. 1, 2, 3, and back down, right? You may not get as high as I do. You may only make it to here, right? All I care about is that you're feeling that muscle on the side of the hip working, okay? Again, we want to make sure this oblique is locked in. So they come up, hold 1, 2, 3, and back down. So they come up, 1, 2, 3, back down. Maybe do like 5, okay? Now, do that for a few days, maybe even a couple weeks, depending on how comfortable you are with those 3 movements. But we still want to progress them, right? And before we progress to a more functional movement, we want to make sure that we can control the abduction and the rotation at the same time. So the way we do that, same thing, make sure you lock in that oblique. We're going to lift up to abduction, and from there to do internal rotation and external rotation, you want to imagine the knee is your pivot point, right? So my knee isn't going to move, but my foot is going to go back and forth, okay? This is really going to fatigue your glute med, the side of your hip. And if this starts to irritate your hip, come down a little lower, do it from there, right? That may help you a little bit. But ultimately, we want that side of the hip to stay locked in, okay? And do like sets of 10, 5, whatever you can really tolerate, right? This isn't about completely fatiguing the glute med until you can't do any more repetitions, and then you have to wait a few days, recover, and then try it again, right? I would rather you do it more with frequency, right? We want higher frequency, so just like 5 to 10 of each one of those 2 or 3 times throughout your day, because what we're ultimately doing is teaching the brain how to control that muscle. Most of the time, you don't actually need more muscle fibers in the hip. You just have to learn how to control those muscle fibers. The strength and the ability of that muscle to move force, basically the muscle fiber getting bigger will come with time as you challenge it. We're not focused on that. We're focused on connecting the brain to that muscle. So those are several different ways in one sequence. So you can do all of those in one sequence to strengthen and control and activate the gluteus medius, which is crucial to almost every functional movement. Training all 3 actions of the gluteus medius will help you break the pain, rest, pain cycle of hip pain. And this is just the first step. Once you can control this muscle more, you can start integrating this control into your daily life when you squat, walk, or even stand from a chair. If you want more guidance from me so you can achieve long-term relief and management of your hip pain without surgery, download the free You Improve PT app and try one of my pain relief programs for free. Just click the link in the description below to get started. You can also subscribe to this channel so you don't miss a video on living life without pain. And make sure you tell me your hip pain story in the comments below. Thanks for watching.